integrated care pathway is a step-by-step guide to treatment for patient or client, and it's a guide for all of the team members providing care for that individual.
An integrated care path would ensure that everyone gets the same standard of care, that they are provided the same services and resources regardless of who their psychiatrist or case manager is.
It ensures that we will be able to standardize care to make sure that the journey of the client from the moment they step into CAMH to the moment that they leave meets excellent clinical care.
Integrated care pathways are widely used in the rest of medicine. For instance, if you had a heart attack and you showed up in an intensive care unit, the nurses will start a series of steps to limit the damage to your heart before you're even seen by a physician.
There's a lot of things that happen along the way for a person as they come in the door that can actually help them get better. So not just through standard medication treatments, but even just the nature of the interaction when someone comes in the door of an inpatient unit or into a clinic can matter. So just making sure everyone gets that opportunity that they deserve to get that high level of treatment at every step of the way is really important, I think, in mental health.
So as soon as a client comes onto the unit, we give them an orientation of the unit, and we also give their family an orientation of the unit. So we support the client through the whole transition from admission to the unit until they're discharged.
Families would feel more supported with regard to their loved one receiving care and services. They would know that there is a certain expectation. They would be involved in it. We always involve the families when we work with our young people. And they would, I think they would see what exactly happens in our programming. Because lots of times families, they're not really sure.
As a physician, it will help me determine whether what we are doing in our clinic is the right thing. I think clinically speaking, personally speaking, I think we're doing really good work, but it will help me and our team evaluate ourselves, because ultimately all we want to do is offer the best to our clients and their families.
The thing I really like the most about ICPs is that they're flexible and they're built to last. And the reason I say that is because right now we have a body of knowledge that is integrated into the ICPs that we deliver. But as new findings come out through clinical research or through clinical trials, it can immediately go into an ICP as another step in the pathway. So if we have a genetic test, for example, that can predict whether someone will respond to medication or whether someone will have bad side effects, that can just be a key step in the pathway that everyone gets the opportunity to have. So I think it's a really exciting long-term plan, not just a short-term plan for CAMH.